Hi, I'm Dr. Aaron Spitz. I'm a board-certified urologist. I'm a partner at Orange County Urology Associates, and I'm an associate professor at UC Irvine Department of Urology in Irvine, California. I'm going to speak to you about help for ED, or erectile dysfunction. Erectile dysfunction is a common condition, and it affects about half of men starting at age 50, and it increases from there to about 90% of men by age 90. In fact, it even affects some men in their 40s. Although in a small number of cases there is a psychological factor, in the majority of cases it's a medical, physical condition, and it can be helped. An erection is a physiological event wherein there's a signal from the brain that triggers blood to flow into the penis fills with blood, and then it traps the blood so that it becomes firmer and harder until there's an erection that is satisfactorily hard for penetration for intercourse. ED is a problem anywhere along that pathway. First, a signal arises from the brain. It's important to have a desire for sex, and testosterone at normal levels allows for that desire. Then the nerve pathways leading from the brain down to the penis must all be intact. That is, the spinal cord, as well as nerves that run through the pelvis, as well as nerves within the penis itself. Those nerves release chemicals that cause the blood vessels entering the penis to open up and allow more blood to flow through. That then enters a special type of a spongy space within the body of the penis, which is actually a fine matrix of smooth muscles and blood vessel-like linings that are soft and compliant, and the signal makes them become even softer so that they can fill up with blood, expanding the size of the penis, and then the blood gets trapped, and so as more blood fills in, the penis becomes firmer, much like pumping up a bicycle tire. That's the normal erection. ED is a breakdown somewhere along that pathway. If a man's testosterone level is too low, he may not have the desire to start the whole process. If he's had a spinal cord injury or an injury to the nerves of his pelvis from a previous surgery, particularly a prostate cancer surgery, then the signal can't get to the penis. If the blood vessels are diseased, as is common with atherosclerosis or smoking, which causes a hardening of the arteries, even though the signal is there, the blood can't flow properly because it's restricted. Or if that spongy tissue within the penis is diseased from diabetes or advanced atherosclerosis, although the blood may enter, the penis can't stretch and expand normally. Or finally, even though if the blood enters and the penis expands, if it can't be trapped properly because the veins aren't closing off as they should, then the erection cannot be maintained. There are a variety of known medical conditions that may cause erectile dysfunction. One of the most common is diabetes, because diabetes affects both nerves and blood vessels, particularly the smaller blood vessels like are in the penis. Kidney disease also affects erections, particularly if a patient requires dialysis. Multiple sclerosis, which affects the nerves of the spinal cord. Atherosclerosis, as I mentioned, affects all the blood vessels, and because the blood vessels to the penis are small in caliber, smaller than the arteries to the heart or the arteries to the neck, erectile dysfunction may be the very first sign of serious underlying blood vessel disease, and erectile dysfunction is often an important clue that it's important to get a heart checkup, because after erectile dysfunction, the next event may be a heart attack or a stroke. There's a variety of medications that can impact erections. In fact, over 200 medications are implicated in causing erectile dysfunction. The most common are medications for high blood pressure, such as beta blockers or diuretics like hydrochlorothiazide. Although erectile dysfunction is common and the causes are varied, there is typically a prevention or a treatment for just about any cause of erectile dysfunction. If a patient is willing to ask for help from their doctor can usually provide a satisfying solution. It wasn't very long ago that there wasn't very many good options for men who had erectile dysfunction. Surgery has been around for some time, but until the advent of oral medications or injectable medications, treatments were rather limited. These days, however, there are several excellent treatment options that don't require surgery and can restore natural, strong erections. These options include oral medications, injections, and vacuum devices.